Hello, and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Salmonella Paratyphi under the section of infectious diseases. The epidemiology of this is that it only affects the human, and it is as a result of contaminated food or drink, poor sanitation, and also crowded accommodation. There is a higher incidence in South and Southeast Asia. The pathophysiology of Salmonella Paratyphi is that it is a gram-negative rod-shaped bacterium. It causes parathyphoid fever, usually less severe than typhoid fever. There are three main serotypes: Paratyphi A, Paratyphi B, and Paratyphi C. Paratyphi A is the most prevalent globally. It is as a result of fecal-oral transmission, and there is also the absence of V capsule, which is different to Salmonella typhi, in which V capsule is present. Invasion of protein and endotoxins contribute to pathogenicity. The clinical manifestations is really quite similar to typhoid fever in that it can start with non-specific constitutional symptoms such as fever, headache, loss of appetite, nausea. It can then lead to abdominal pain and presence of rose spots. However, generally, it is a milder disease than typhoid fever, but there is still potential for severe complications. The management of this is again with oral fluoroquinolones or third generation cephalosporins. And treatment, unfortunately, is complicated by ongoing emerging resistant patterns. This is the case that you really need to be guided by your local microbiologist for appropriate therapy, especially if you're concerned about a potential pattern of resistance. Let's do some questions. A 30-year-old man presents with a 4-day history of high fever, mild abdominal pain, and lethargy. He recently returned from a trip to Southeast Asia. On examination, you notice a few faint pink spots on his abdomen and lower chest. These spots are slightly raised and disappear on pressure. Given the description, what is the characteristic rash associated with Salmonella Paratyphi infection known as? Options are erythema multiforme, option B, erythema marginatum, option C, urticaria, option D, livedo reticularis, and option E, rose spots. If you were listening, you would realize that this is classically describing the characteristics of rose spots, which are these faint pink spots typically affecting the abdomen and lower chest. They are slightly raised and they classically disappear on pressure. So the correct option is going to be option E. For those of you who may not be familiar with the other options that are described, you would be able to click the link here for our sections under rheumatology and dermatology, in which we will be talking in a lot more detail about option D, which is the net-like rash that affects the skin and is associated with a few classic rheumatological manifestations, which you certainly need to know for your exams, and option A and B, which is classically affecting the skin in a few of the classic dermatological manifestations. So please feel free to refresh your memory by looking at our previous library information on rheumatology and dermatology. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.